If you are over 60 and living with burning feet, numb toes, electric tingling, or an unsteady sense of balance, what you are experiencing is not a mystery of aging. It is the predictable outcome of a biological environment that has quietly shifted over time. Most people are told that peripheral neuropathy is simply something that happens as nerves wear out, as if the nervous system were a mechanical object destined to fail on schedule. Others are told it is genetic, implying there is nothing to be done. And many are told, directly or indirectly, that treatment is limited to managing pain and learning to live with decline. What almost no one explains is that nerves do not deteriorate randomly. They respond to chemistry. They respond to blood flow. They respond to the metabolic signals they are exposed to every single day. When those signals become hostile, nerves suffer. When they stabilize, nerves often surprise us with how much function they can retain. Peripheral neuropathy is not a single disease. It is a pattern of injury. It describes what happens when peripheral nerves, the long communication cables that connect the brain and spinal cord to the rest of the body, begin to malfunction. These nerves are responsible for sensation, movement, balance, temperature perception, and pain signaling. Because they are long and metabolically demanding, they are uniquely vulnerable to changes in blood sugar regulation, circulation, inflammation, and nutrient availability. This vulnerability explains why symptoms often appear first in the feet and hands, the areas farthest from the heart, and most dependent on tiny blood vessels for nourishment. One of the most important concepts to understand is that nerve damage develops long before nerve pain does. For years, sometimes decades, nerves can be exposed to subtle but persistent metabolic stress without producing dramatic symptoms. During this time, damage accumulates quietly. Proteins inside nerve fibers begin to change shape. Blood vessels stiffen. Protective insulation thins. Electrical signals slow and become less precise. The nervous system compensates remarkably well, masking early dysfunction. By the time burning, numbness, or instability becomes noticeable, the process is already well underway. This delay is what makes neuropathy feel sudden and unfair, even though it has been building gradually beneath the surface. At the center of this process, for a large percentage of people, is a class of compounds called advanced glycation end products, commonly abbreviated as AGEs. These compounds form when glucose molecules bind irreversibly to proteins and fats in the body. This is not a benign attachment, it changes the structure and behavior of the tissues involved. Once formed, AGEs are difficult to remove, and they accumulate over time. They are particularly damaging to tissues that rely on flexibility, precise signaling, and delicate blood flow, which makes peripheral nerves a prime target. To understand why AGEs matter so much, it helps to visualize what happens at the molecular level. Glucose is an essential fuel, but it is also reactive. When blood sugar remains elevated for extended periods, glucose molecules collide more frequently with proteins. Under the right conditions, they bind together, forming stiff, sticky complexes. This process is similar to caramelization when sugar is heated during cooking. In the body, it happens slowly but relentlessly when glucose levels are poorly regulated. The result is tissue that is less flexible, less functional, and more prone to inflammation. Inside peripheral nerves, AGEs damage three critical components at once. First, they alter the nerve fibers themselves, interfering with the proteins responsible for transmitting electrical signals. Second, they damage the myelin sheath, the fatty insulation that allows nerve impulses to travel quickly and efficiently. Without healthy myelin, signals become weak, delayed, or distorted. Third, AGEs injure the tiny blood vessels that supply nerves with oxygen and nutrients. These capillaries are essential for nerve survival. When they stiffen or narrow, nerves become starved and vulnerable. This triple assault explains why neuropathy symptoms are so varied. Burning pain reflects irritated, overactive nerve fibers. Numbness reflects signal loss. Tingling reflects misfiring. Weakness reflects impaired communication with muscles. Balance problems reflect disrupted sensory feedback to the brain. These symptoms may appear in different combinations, but the underlying damage follows a common pattern. A crucial and often misunderstood point is that fasting blood sugar is a poor indicator of this process. Many people with neuropathy are told their glucose levels are normal because their fasting numbers fall within reference ranges. But fasting glucose reflects the lowest blood sugar level of the day, not the most damaging. The greatest opportunity for age formation occurs after meals, when blood sugar rises and stays elevated for hours. These post-meal spikes are where nerve injury accelerates, especially when they happen day after day, year after year. As we age, the body becomes less efficient at clearing glucose from the bloodstream. Muscle mass declines, insulin sensitivity decreases, and glucose remains elevated longer after eating. This does not mean aging causes neuropathy. It means aging reduces metabolic resilience. When combined with modern eating patterns, frequent snacking, late-night meals, and processed foods, this reduced resilience creates the perfect environment for age accumulation. Vitamin B12 plays a critical role in this story because it is essential for nerve maintenance and repair. B12 supports myelin integrity, DNA synthesis in nerve cells, and the detoxification pathways that help neutralize metabolic byproducts. Unfortunately, B12 absorption declines with age, and it is further impaired by common medications such as acid suppressants and metformin. When B12 levels fall, nerves lose one of their key protective mechanisms. Damage that might have been repaired instead accumulates. What makes this particularly problematic is that standard blood tests often miss functional B12 deficiency. Levels may appear normal while being inadequate for neurological health. This disconnect leaves many people vulnerable without realizing it. By the time symptoms appear, deficiency may have been present for years. Another underappreciated contributor to neuropathy is dietary age intake. Ages are not only produced inside the body, they are also consumed. Foods cooked at high temperatures, especially those that are grilled, fried, roasted, or browned, contain large amounts of pre-formed ages. These compounds are absorbed into circulation and add to the body's overall burden. This means that even people with relatively stable blood sugar can accelerate tissue damage through cooking methods alone. Lower temperature cooking techniques significantly reduce this exposure. Inflammation acts as an amplifier once nerve damage has begun. AGEs activate inflammatory pathways that keep nerves in a state of chronic irritation. This is why symptoms often worsen at night when circulation slows and inflammatory mediators linger. It is also why neuropathy frequently disrupts sleep, creating a vicious cycle. Poor sleep worsens insulin resistance, raises stress hormones, and increases post-meal glucose spikes the following day. This fuels further age formation and inflammation, which then worsens sleep again. Movement is one of the most powerful tools for interrupting this cycle. Muscles act as glucose sinks, absorbing sugar from the bloodstream after meals. Even brief periods of walking can significantly reduce post-meal glucose levels. This is not exercise for weight loss or fitness. It is metabolic regulation. Regular movement reduces the raw material needed for age formation and improves circulation to nerves. Strength also matters. As muscle mass declines, glucose clearance worsens. Gentle resistance training helps preserve muscle tissue, improving metabolic control and indirectly protecting nerves. This effect is often underestimated because it works quietly in the background rather than producing immediate symptom relief. Hydration supports circulation and metabolic clearance. Dehydration thickens the blood, reduces capillary flow, and concentrates glucose. Many older adults unintentionally limit fluids, which subtly worsens nerve vulnerability. Consistent hydration supports vascular health without requiring drastic changes. Stress influences neuropathy through hormonal pathways. Chronic stress raises cortisol, which increases blood sugar and promotes insulin resistance. Emotional stress does not cause neuropathy by itself, but it magnifies the metabolic conditions that damage nerves. Simple stress management practices reduce this hormonal pressure and support metabolic stability. One of the most damaging beliefs surrounding neuropathy is the idea that decline is inevitable. This belief discourages action and fosters resignation. While it is true that severely damaged nerves may not fully regenerate, many partially damaged nerves can stabilize and function more efficiently when the environment improves. People often experience reduced pain, better balance, improved sleep, and enhanced quality of life when further damage is slowed or stopped. The goal is not perfection, it is preservation. Every hour of stable blood sugar is an hour without chemical assault on nerves. Every night of better sleep supports repair. Every small reduction in inflammation improves signaling. Over time, these changes compound in a positive direction, just as damage once compounded in a negative one. Peripheral neuropathy is not simply a nerve disorder, it is a metabolic condition that reveals itself in the nerves first. Understanding this reframes the condition from an unavoidable fate to a manageable process. It shifts the focus from chasing symptoms to stabilizing the underlying environment. This shift does not promise miracles, but it offers something more reliable: control. And control changes everything. As people begin to understand that peripheral neuropathy is rooted in long-term metabolic strain rather than sudden nerve failure, another realization often follows. The nervous system is not isolated. It exists in constant conversation with every other system in the body. Blood vessels, muscles, hormones, the immune system, and even the digestive tract all influence whether nerves remain resilient or become fragile. This interconnectedness explains why neuropathy rarely exists alone. It often appears alongside fatigue, poor sleep, digestive changes, balance problems, or subtle cognitive fog. These are not separate issues, they are different expressions of the same underlying instability. One of the most overlooked contributors to nerve damage is chronic post-meal hyperglycemia that never reaches the threshold of diabetes. Many people live for years in a metabolic gray zone where blood sugar spikes higher and stays elevated longer than ideal, yet still falls within acceptable lab ranges. During this time, ages accumulate quietly. The absence of a diagnosis creates a false sense of security. People assume that if something were wrong, it would have been flagged. But neuropathy does not wait for a label. It responds to exposure. The nerves do not care whether a number crosses an official line. They care about how often they are bathed in damaging chemistry. The body's ability to clear glucose depends heavily on muscle tissue. After eating, insulin signals muscles to absorb glucose and store it as glycogen. When muscle mass is reduced, this clearance system becomes less effective. Glucose lingers in the bloodstream longer, increasing the opportunity for glycation reactions to occur. This is one of the reasons neuropathy risk rises with age, independent of body weight. Even individuals who appear lean and healthy may have lost significant muscle mass over time, especially if they have not engaged in resistance-based activity. This muscle-glucose relationship also explains why physical activity has such a pronounced effect on nerve health, even when diet remains unchanged. A short walk after meals, repeated consistently, can reduce the height and duration of glucose spikes. Over months and years, this reduction translates into fewer ages, less inflammation, and improved circulation. The effect is subtle in the short term, but profound over time. It is one of the rare interventions that addresses cause rather than consequence. Another system deeply involved in neuropathy progression is the vascular system. Nerves depend on an intricate network of microscopic blood vessels. These vessels are highly sensitive to glycation and oxidative stress. Ages stiffen vessel walls, reduce nitric oxide availability, and impair the ability of blood vessels to dilate in response to demand. This results in chronic low-grade ischemia, particularly in distal nerves. The feet are affected first not because they are weaker, but because they are last in line for blood supply. This vascular component explains why symptoms often worsen in cold environments or at night. Reduced circulation amplifies nerve dysfunction. It also explains why smoking, even years in the past, increases neuropathy risk. Smoking damages blood vessels in ways that compound metabolic injury. The nervous system remembers these insults long after exposure ends. Inflammation weaves through every stage of this process. Ages activate receptors on immune cells that trigger inflammatory cascades. These cascades increase oxidative stress, damage mitochondria within nerve cells, and further impair insulin signaling. Inflammation becomes both a result of damage and a driver of further injury. This feedback loop is one reason neuropathy can accelerate once symptoms appear, even if lifestyle remains unchanged. Sleep is one of the few times the body prioritizes cellular repair. During deep sleep, inflammatory signals decrease, insulin sensitivity improves, and growth factors support tissue maintenance. When neuropathy disrupts sleep, this repair window shrinks. Over time, insufficient restorative sleep worsens metabolic control and accelerates nerve damage. This bidirectional relationship explains why improving sleep quality, even modestly, can have outsized effects on symptom stability. Late-night eating is particularly harmful in this context. Consuming food close to bedtime raises blood sugar during hours when insulin sensitivity is naturally lower. This prolongs hyperglycemia and interferes with nocturnal repair processes. Many people notice that shifting their last meal earlier leads to improved sleep within days, followed by gradual improvements in neuropathy symptoms. This change requires no new foods, supplements, or medications. It simply respects the body's circadian rhythms. Digestive health also influences nerve function. The gut plays a role in nutrient absorption, immune regulation, and inflammation. Poor digestion, altered gut motility, or chronic irritation can impair absorption of key nutrients such as B vitamins and magnesium. It can also promote systemic inflammation. While gut issues are rarely the sole cause of neuropathy, they can exacerbate vulnerability and limit recovery. Supporting digestive health becomes another way of improving the environment nerves depend on. The emotional impact of neuropathy deserves equal attention. Chronic discomfort, uncertainty, and fear of progression can lead to anxiety and depression. These emotional states further disrupt sleep, increase stress hormones, and reduce motivation for self-care. This creates another feedback loop, one that is psychological rather than biochemical, but no less real. Breaking this loop requires understanding, support, and realistic expectations rather than blame or denial. It is important to acknowledge that not all neuropathy is metabolic. Autoimmune disorders, infections, toxins, chemotherapy, and genetic conditions can also damage nerves. However, even in these cases, metabolic health influences severity and progression. Stabilizing blood sugar, reducing inflammation, and supporting circulation benefit nerve health regardless of the initial cause. This universality makes metabolic support a foundational strategy rather than a niche one. As people adopt changes that stabilize their metabolic environment, progress often appears in subtle ways. Pain intensity may decrease slightly, sleep may improve, balance may feel steadier, temperature sensation may return. These changes are easy to overlook if one expects dramatic reversal, but they are meaningful. They indicate that ongoing damage has slowed and that surviving nerve fibers are functioning more efficiently. It is crucial to measure progress over weeks and months rather than days. Nerves heal slowly. Metabolic adaptations take time. Fluctuations are normal. A bad day does not negate progress. Looking at overall trends provides a more accurate picture and prevents discouragement. For individuals with advanced neuropathy, the focus shifts from recovery to preservation. Preventing further loss of function can dramatically improve quality of life. Reduced pain, better sleep, and improved balance allow people to remain independent longer. These outcomes matter deeply, even when full sensation does not return. Medical collaboration remains essential. New or rapidly progressing symptoms require evaluation to rule out other causes. Medications may be necessary for symptom control and should never be discontinued without supervision. The strategies discussed here are not replacements for medical care. They are complementary approaches that address mechanisms often left unaddressed in standard treatment models. As research advances, the narrative around neuropathy is slowly changing. What was once considered an inevitable consequence of aging is increasingly understood as a modifiable process influenced by lifestyle, metabolism, and systemic health. This does not mean everyone will recover fully. It means that many people have more influence over their trajectory than they were ever told. The most important shift is conceptual. Neuropathy is not something that happens to people. It is something that develops within an environment. Change the environment and you change the outcome. Not instantly, not perfectly, but meaningfully. Long-term stabilization of peripheral neuropathy depends less on dramatic interventions and more on consistency across small, repeatable behaviors. The nervous system responds to averages, not exceptions. One perfect week followed by months of neglect does little to change trajectory. But modest improvements sustained over years can fundamentally alter the course of decline. This principle often feels unsatisfying in a culture conditioned to expect fast results, yet it aligns closely with how nerve tissue actually adapts. Aging physiology plays a central role in why neuropathy becomes more common with time. As the body ages, insulin sensitivity naturally declines, mitochondrial efficiency decreases, and inflammatory signaling becomes more pronounced. These shifts occur even in people who maintain a stable weight and appear outwardly healthy. The decline is gradual and easy to ignore until symptoms appear. Understanding this process reframes neuropathy not as a sudden failure but as the cumulative result of decades of subtle drift. One of the most impactful yet underestimated changes with aging is the loss of neuromuscular communication. Motor neurons that control muscle fibers gradually withdraw, leaving some fibers denervated. The remaining neurons compensate by branching to re-innervate abandoned fibers, but this compensation has limits. Over time, the quality of movement declines, balance becomes less precise, and the feedback loop between nerves and muscles weakens. This deterioration increases fall risk and further reduces physical activity, accelerating muscle loss and metabolic instability. Foot health deserves special focus as neuropathy progresses. Reduced sensation increases the risk of unnoticed injuries, infections, and pressure-related damage. Daily inspection becomes a protective habit rather than a sign of vulnerability. Proper footwear, moisture control, and attention to calluses and nail health reduce secondary complications that can dramatically worsen outcomes. Many severe neuropathy-related disabilities arise not from nerve damage itself, but from preventable foot injuries that went unnoticed. Chronic pain alters brain processing over time. Regions involved in sensation, emotion, and attention become hyper-responsive. This phenomenon, known as central sensitization, amplifies discomfort and reduces pain thresholds. Addressing neuropathy therefore involves not only peripheral nerves but also central nervous system regulation. Practices that calm the nervous system, slow breathing, mindfulness, gentle stretching, can reduce symptom intensity even when structural nerve damage remains unchanged. Micronutrient sufficiency should be monitored, especially for nutrients involved in nerve function. Vitamin B12 deficiency, for example, can mimic or worsen neuropathy. Magnesium plays a role in nerve conduction and muscle relaxation. While supplementation should be guided by testing and medical advice, awareness of these nutrients helps ensure that reversible contributors are not overlooked. Hydration influences blood viscosity and circulation. Mild chronic dehydration can reduce microvascular flow, subtly worsening nerve ischemia. Older adults often experience reduced thirst sensation, increasing dehydration risk. Regular fluid intake, adjusted for activity and social engagement, plays a surprisingly protective role. Isolation increases stress, worsens sleep, and reduces motivation for self-care. Maintaining connections through family, community, or shared activities supports mental health and indirectly improves physical outcomes. Movement often happens more naturally in social contexts, further benefiting metabolic stability. Fear of progression can quietly dominate decision-making. People may avoid activity to prevent pain or injury, unintentionally accelerating decline. Education helps replace fear with informed caution. Movement adapted to current capacity is safer than inactivity. The nervous system thrives on use. Disuse signals the brain that a region is no longer valuable, reducing investment in maintenance and repair. Healthcare systems often struggle to address chronic conditions holistically. Appointments are brief, symptoms are complex. Patients may feel dismissed or misunderstood. Preparing for medical visits with clear symptom descriptions, timelines, and questions improves communication. Advocating for oneself is not confrontational. It is a necessary skill in managing long-term conditions. Caregivers also need support. Watching a loved one experience chronic discomfort can be emotionally taxing. Education helps caregivers understand that fluctuations are normal and that progress is rarely linear. Shared expectations reduce tension and improve cooperation. Caring for the caregiver ultimately benefits the person with neuropathy as well. As the years pass, the cumulative effect of small supportive choices becomes evident. People who prioritize metabolic stability, movement, sleep, and emotional well-being often experience slower decline and fewer complications. Their symptoms may not disappear, but they become more manageable. Life remains rich and engaged rather than constrained. The final and perhaps most powerful concept is this: neuropathy does not define identity. It is a condition, not a character trait. People are not neuropathy patients first and foremost. They are individuals with histories, relationships,